Today's lecture is pancreas. So pancreas is a accessory digestive organ, and it lies obliquely across the posterior abdominal wall, and it is located in the lower part of the epigastrium and left hypochondria. So in here, there is a epigastrium region. So in the epigastrium region, this is a stomach and left lobe, right? This is a left lobe of the liver. So in here, epigastric region. So epigastric region, the pain. So you must tell the epigastric region pain is the stomach, pancreas, and the liver, and heart also. And it is retroperitoneal structures. So what is retroperitoneal structure? So retroperitoneal means the organ anterior surface is covered by the peritoneum, but posterior surface is not covered by the peritoneum. That's why the organ sits directly on the posterior abdominal wall. So you must know that what are the structures of the, what are the organs of the retroperitoneal structure. It is exocrine and endocrine gland. So exocrine portion, so this is the external secretions. This is the pancreatic juice, enters the duodenum via the pancreatic duct. And endocrine portion, so it is the internal secretion, that is insulin and glucagon, enter the blood. Length is 5 to 6 inches, and the weight is 3 ounces. Shape is a cane shape with a curved handle. So I will show the slide. So cane shape with a curved handle. So this is a cane shape with a curved handle into the, this is a duodenum. It has 4 parts: head, neck, body, and tail. The head. The head is located within the curve of the duodenum on the right side of the vertebral column. It lies inferior to the transpyloric plane. So transpyloric plane is a L1 level. It is uncinate process. So this is the uncinate process. So what is the uncinate process? Uncinate process is a prolongation, extends upward to the left and lies here, posterior to the superior mesenteric vessels. So relation of the head of the pancreas or relation of the pancreas. It lies anterior to the inferior vena cava, the blue color, and the right renal verse. I will show the next slide. And left renal vein, bile duct, right crest of the diaphragm. I will show the next slide. This is a posterior relation. It lies anterior to, mean this is a posterior relation of the pancreas. So anterior relation of the pancreas, peritoneum. Because of the anterior surface of the pancreas is covered by the peritoneum, but posterior surface is not covered by the peritoneum. That's why it is called the retroperitoneal structure. And this anterior relation, so anterior is covered by the transverse mesocolon. So anterior relation is the peritoneum and transverse mesocolon. So the neck, so in the here neck, the neck is 2 centimeter long. In the neck, it is groove. So in the posteriorly, there is a groove. So in the groove, this is a splenic vein, this is a superior mesenteric vein, unite to form the portal vein. So in here, this is a superior mesenteric vein, this is a splenic vein, unite to form the portal vein. So this portal vein go to the liver, and from the liver, the anterior, posterior, right, left, middle, hepatic veins drain to the inferior vena cava. Body. The body is a triangular on cross section. It has 3 surfaces: anterior, posterior, and inferior surface. Here, anterior surface. Anterior surface of the pancreas always covered by peritoneum, but posterior surface is not covered by the peritoneum. That's why it is called the retroperitoneum. Here you can see the stomach bed. So you must know what is stomach bed. So if you want to see the stomach bed, that means this is the posterior surface of the stomach. So posterior surface of the stomach, you can see the many organs. So here you cut the stomach. That's why you can see the posterior structures of the stomach. So stomach bed, what are the contents? What are the stomach bed structures? Pancreas, spleen, left kidney, left suprarenal gland. Here, this is a transverse colon. Between the transverse colon and pancreas, this is a transverse mesocolon. And splenic vessels and the diaphragm. So this is the stomach bed structures. So you already know at the stomach lecture. So that's why pancreas is a part of the stomach bed. So posterior surface. So posterior surface is devoid of peritoneum. That's why it is retroperitoneal structure. So in the posterior surface, you can see here the red color. This is a aorta. And here you can see red color, superior mesenteric artery, and left renal gland, left kidney, and its vessel. So posterior surface, I will show here. Posterior relation of the pancreas. So posterior relation, if you want to posterior relation, you remove the pancreas. Now there is no pancreas because the pancreas is removed. So you can see the posterior structures of the pancreas. Here, suprarenal gland, left kidney, left renal artery, and vein. Here, blue and then red color. And superior mesenteric artery, and here this is a abdominal aorta. This is the posterior relation of the pancreas. So now inferior surface. Inferior surface is here. This is the pancreas. Inferior surface, or this is the lower border. This is a superior border. This is a inferior border and inferior surface. This is the transverse colon. So between the transverse colon and pancreas, this is the transverse mesocolon. That's why inferior surface is covered by transverse mesocolon. And the body of the pancreas is intimately related to the here. This is a splenic vein. This splenic vein is drained. That is a splenic vessels drain at the here. Supply the drain and supply. This is a drain that from the splenic vein. Blood supply is from the splenic artery. This is the spleen. The tail. The tail is here. The left end, narrow left end, thick. It passes between the two layers of the black color, lienorenal ligament, together with the red and the blue color, splenic vessels. So splenic artery is tortuous. And below splenic artery there is a splenic vein. So it ends, the tail ends at the hilum of the spleen. So you must know another question, lienorenal ligament. Contents of the lienorenal ligament, you can see yellow color and the red color and blue color. So splenic artery, splenic vein, and tail of pancreas. So this is a transverse colon, this is a descending colon. In here, this is a between the spleen and this colon, this is a splenic flexor. In the spleen, there is the area related to the stomach. This is the left kidney. So now it has two pancreatic ducts. So main pancreatic duct and accessory pancreatic duct. Main pancreatic duct opens into the major duodenal papilla and together with the bile duct. So I will show the next slide. Bile duct. Bile duct and main or chief or principal pancreatic duct. Accessory pancreatic duct. Another one here. This is the accessory pancreatic duct. Duct of Santorini. Opens into the minor papilla. So this is the major duodenal papilla. This is the minor duodenal papilla. This is the second part of the duodenum. So minor and major, which is cranial, which is located. This is located 2 cm cranial to the main. So above the main is the accessory pancreatic duct. So in here, this is the main pancreatic duct. This is the accessory pancreatic duct. Opens. This is the major papilla. This is the minor duodenal papilla. And this the main pancreatic duct together with the bile duct opens into the second part of the duodenum. Arterial supply. So arterial supply, this is a yellow color is the pancreas. So this is the abdominal aorta. From the abdominal aorta, the celiac branch comes from the abdominal aorta. So from the celiac trunk again gives the three branches. One is the splenic artery, two is the left gastric artery, go to the supply to the stomach, lesser curvature. And then this is the common hepatic artery. From the common hepatic artery, there is a gastroduodenal artery. So gastroduodenal artery is, where is the gastroduodenal artery? So this is the head of the pancreas, this is the neck of the pancreas. Between head and neck of the pancreas, there is a groove. So this groove is passed through by the GD, gastroduodenal artery. And then this is a duodenum, second part of the duodenum. This is a pancreas. Between pancreas and head of the pancreas and duodenum, there is another artery, the red color. This is a pancreaticoduodenum. Above is a superior pancreaticoduodenum. Below is a inferior pancreaticoduodenum. So arterial supply come from this tortuous splenic artery, pancreaticoduodenal artery. This is the arterial supply to the pancreas. Another one, venous drainage. The vein here, the blue color, is a splenic vein, and then so from the splenic vein drain to the portal vein. And here from the another vein is a superior mesenteric vein here. Superior mesenteric vein unite with the splenic vein to form the portal vein. So mostly portal vein drain into the, mostly is a splenic vein. But here pancreatic the veins drain to the portal, splenic vein and superior mesenteric vein. But mainly is a splenic vein here. So lymphatic drainage. Lymphatic always follow the arteries. So in here there is a lymph nodes. So pancreaticosplenic in here, pancreaticosplenic, splenic lymph nodes, pancreaticosplenic lymph nodes. Here this is the superior mesenteric artery. Along the superior mesenteric artery, superior mesenteric lymph nodes. So these are the lymphatic drainage. Nerve supply, sympathetic and parasympathetic. So parasympathetic is here, right and left vagus. This is the parasympathetic to control the pancreas secretion. And then sympathetic is a splenic nerves plexus around the artery. This is the sympathetic. Apply. Number one, pancreatic injury. So when auto accident. So this is the auto accident because of the forceful compression on the abdomen. So sometimes pancreas rupture. So when pancreas rupture, pancreatic juice come out. So this pancreatic juice enter the substance of the gland, pancreatic gland and adjacent tissue. So injury to the gland and adjacent tissue resulting in the autodigestion. It's a very serious and very painful. Number two, cancer of the pancreas. So pancreatic cancer is mostly occurs at the head. So when the tumor, the compress the biliary system and then also pressure on the portal vein. So it causes the portal hypertension and obstruction of the biliary system and the results in patient with jaundice. Number three, annular pancreas. So annular pancreas is a congenital defect. You will know the development of the GI system. So in the development, first initially pancreas has two buds. There is a ventral bud and dorsal bud. So ventral bud and dorsal bud is a fuse. There is a normally, but sometimes failure to fusion and then rotation is an abnormal rotation, a defect in the rotation of the pancreas causing ring-like pancreatic tissue surrounds the duodenum. So like a ring-like that is called annular pancreas, and then compress the duodenum and causing stenosis or complete obstruction. Number 4, acute pancreatitis. That means inflammation of the pancreas when eating too much, so which causes severe pain in the abdomen.